Hello from your favorite dentist, Dr. G. We are going to talk about dentures. First and foremost, do everything in your power that you retain your teeth. Good oral hygiene, all the good stuff we've talked about. But if somebody gets older or for many reasons, let's say somebody loses their teeth, it's not the end of the world. And dentures are a great solution. We have to be realistic about dentures. The force of biting with dentures is 1/8 of the bite force with natural teeth. So when you are getting dentures, be realistic. Do not expect magic from your dentist. Don't think that they are going to make some teeth for you that they actually look like natural teeth, and at the same time they are going to have the same force of biting as natural teeth. It will not happen. The upper denture is usually a lot more stable than the lower denture, because you have the suction effect, basically like those suction cups that people use whenever they put on the glass and they hold on pretty tight. The same suction effect happens when you have dentures. And keep in mind, it also covers a lot of the taste buds. You not only have taste buds on your tongue, you have taste buds on your palate. It's not your imagination if you start losing some of your taste when you have dentures. Regarding the lower denture, because you have the arch of the lower teeth right there, and you have the tongue actually in the lower floor of the mouth, you cannot make a denture that actually has a suction effect. It will be looking like a horseshoe. The denture will just actually look like a U shape, and that U shape has to sit on the edentulous area. Edentulous means teethless, toothless. That cannot have a lot of force of suction holding it there. So therefore, we will rely mainly on the denture kind of sitting on the ridge of the edentulous area. And a lot of times people use adhesives, which in a way is a temporary glue to keep the denture in place. So what is the solution? Great news. Implants. My own father, the last few years of his life, he had so much fun eating with his dentures. And our healthcare professionals should not be judgmental of thinking, oh, this person must have been a bad person that didn't take care of his teeth, therefore they lost their teeth. My father lost his teeth when he was only 25. My father was a child slave. What choice do you have when you're poor? What choice do you have when you come from a lower socioeconomic class? That man, when he became a father, all he cared about was fighting for his children. That is noble. Later on, of course, when I became a dentist, I had our periodontist place nice 4 implants, on the lower arch, and 4 implants on the top arch. And we actually can cut the palatal part of the denture from the top, so you actually can taste the food that you eat. And at the same time, when you have the lower implants on the lower arch, and they actually click the denture on top of it, my father could eat steaks, he could eat corn on the cob, he could do anything all the other people do with their natural teeth with his dentures. So a great solution for people who are edentulous and the dentures are wobbling around is to get implants. It is very important for you to get those implants at a very early stage. The sooner you get those implants, as soon as you lose those teeth, the better it is, because when the jaw does not have any teeth, the bone gets recession, and that recession goes pretty fast. And there comes a point that you basically would lose all the bone on the upper arch, and it gets close to your sinuses. So putting implants is going to be very difficult or impossible, because they will go into your sinuses. On the lower arch, I am going to show you the alveolar process and basically showing the lower jaw. So as you see right here, we have the nerve right here. So these teeth actually, the teeth have one of the functions of the teeth is to keep the bone level high. So when a person loses their tooth right here, that bone starts receding, and it will go down further and further and further, and it gets really close to the nerve. So you cannot place an implant going down here because it will hit the nerve and it will cut the nerve, it will damage the nerve, and you can get paresthesia. Paresthesia, which means you get the sense of numbness for the rest of your life. Who needs that? Make sure that every time you lose a tooth and you have a chance to put an implant in its place, place the implant as soon as possible. So the timing is everything in dentistry. For the maintenance of your dentures, make sure you do not use toothpaste to wash and clean the dentures. And it's best to give your mouth a rest, especially at nights. Remove them fully, let your have a rest for your tissue. If you snore a lot and if those dentures are necessary to keep the jaw forward, then you can give that break during the day, part of the night. But it's important that when you are cleaning those dentures, use denture cleansers, or if you use simply hand soap, liquid soap with a toothbrush and gently clean inside the dentures. And once in a while, when you go to your denturist or your dentist, you can have those cleaned by your denturist or dentist professionally. It is important for you to know that the dentures are not a lifetime thing. A set of dentures are good for 5 to 7 years. The teeth, those plastic teeth that are actually on the denture base, they get worn out. And the force of biting becomes really low because the teeth become very flat and it's very hard to chew with them. There are changes in our body and in our system. Like for instance, if you lose weight, the dentures become wobbly and you need to go to your dentist so they can reline inside of it so they can hold better. Of course, if you're having implants, you will have that effect a lot less. Keep in mind, if you are wearing dentures, again, that you don't have any implants supporting them, you continue getting recession of your bone further and further and further, and the dentures become looser and looser, which goes back to my recommendation that you really should do everything in your power to get a few implants to support your denture. The digestion of the food is very important, that you actually bite and chew your food properly. My father, that was another testament that I can share with you, is that he used to have digestion problems all the time. He used to have upset stomach all the time. The doctors were giving him all kinds of anti-acid medications all the time. And the poor guy was pretty miserable. When he had a nice set of teeth that he could actually chew his food properly, I kid you not, it was a month or two after that all of his digestive problems went away. He lost some weight because he actually was chewing his food. Remember that when we say more than 70% of the diseases start in the mouth, that's a part of it. Make sure that you keep good oral hygiene, but again, if it turns out that you are going to have dentures or partial dentures, it's not the end of the world, and if they're not stable, the solution is implants. And don't forget, the most important person in your life is you. What that means is that you may have children that you have to take care of. You may have grandchildren that you're trying to buy gifts and things and do things for them. But if your teeth are not functioning well, if your bite is not functioning well and you're not taking care of yourself, how can you take care of them? Be true to your teeth so your teeth don't become false to you.